Okay, we have several work sessions this morning. And Dr. Melick, I see you are online. We have a work session on the Board of Health, and it is November 6th, the day after, although it's probably going to be quite some time before the elections office gets sorting through all those ballots. Thank you for voting. We had a really good voter turnout this year, and that's heartening to see. Dr. Melnick, take it away.
Good morning, counselors. For the record, Dr. Alan Melnick, I'm the Public Health Director and Health Officer. Just a brief update on respiratory illness, particularly around prevention. So as we're getting into the respiratory illness season here. At this point, influenza and RSV, also known as respiratory syncytial virus, activity continues to be very low and is not contributing to local emergency department visits or hospitalizations. And those hospitalizations and ED visits due to COVID-19 have actually decreased over the last several weeks. So in the most recent week of data that I have to share with you, late October, the 20th to the 26th, 1.6% of hospitalizations were due to COVID-19, which is about the same as this time last year. And about 1.2% of emergency department visits are due to COVID-19, which is lower than this time last year. I just wanted to talk briefly, since it's about, we're getting into the season, I want to talk about prevention. Vaccinations continue to provide the best protection against illness, including especially severe illness that can lead to hospitalization and death. COVID-19 has still been with us, and last year in the US was responsible for over 900,000 hospitalizations and more than 75,500 deaths in the United States. And last flu season, an estimated 45,000 people died in the United States from flu complications. Annual influenza and updated COVID-19 vaccines are available and recommended for everyone 6 months of age and older. They can be given at the same time, and the updated vaccines provide protection against the current strains responsible for most infections and hospitalizations. So the numbers, we need to get the message out, and one reason I'm here is that only 10.8% of Clark County residents have received the updated COVID-19 vaccine, compared to, it's not great statewide either, it's 11.2%. And then about 16.5% of Clark County residents have received the this year's flu vaccine, compared to about 17.6% statewide. Most people need only one dose of the updated 2024-25 COVID-19 vaccine, but the CDC just recently updated its recommendation to include a second dose of the 2024-25 vaccine for certain age groups. That includes people who are 65 and older, as well as people 6 months to 64 years who are moderately or severely immunocompromised. And actually, people who are immunocompromised can also consult with their health care provider to see if they need any additional doses. So that's those vaccines. In terms of RSV, this is the second year we've had availability of a vaccine that protects against RSV. It's not an annual vaccine, so if you got it last year, you don't need to get it again. It's a one-time deal. So, but for adults who did not get vaccinated last year, the CDC recommends the vaccine, the RSV vaccine, for people aged 75 and older, as well as people who are 60 to 74 who had increased risk of severe RSV. In Clark County, about 33.9% of adults older 75 and older have received it, compared to about 36.1% statewide. Because of RSV's effect on infants, the CDC recommends that people who are 32 to 36 weeks pregnant during the respiratory illness season get one dose of maternal RSV vaccine to protect their babies. So women who are, for example, pregnant now at 32 to 36 weeks should get the RSV vaccine to protect their babies after they're born. Monoclonal antibodies are also available for some infants based on their age and whether or not their mother was vaccinated and their risk for severe illness. Vaccines for RSV available in Clark County. I talk to your healthcare provider or check your local pharmacy. And also, as usual, we encourage people who have questions about the vaccines to talk to their healthcare providers. And then I just want to give you an update. It is a vaccine preventable illness. I wanted to give you an update on pertussis, also known as whooping cough. We're continuing to see high numbers of whooping cough cases, and most of them are in people who've not vaccinated. So as of October 24th, and we continue to crunch the numbers, we've had 342 cases of whooping cough in Clark County. Last year we had 14. So again, 14 last year, 342 cases so far this year. We're still analyzing the data for October, but among the cases through September, about 64% of the cases had never, ever received even one dose of a pertussis containing vaccine. And as you know, the vaccine isn't given in multiple doses. There's a schedule for it. 64% had never ever received even one dose. And then if you add the people who had some of the vaccine but are not up to date with it, we're at 67% of the cases were in people who are either not immunized or not up to date on their immunization. 44% of the cases have been among children younger than 5, and 12%, which is a population we worry about the most, have been children younger than 1 year. So the best way to prevent getting whooping cough and spreading it is to get vaccinated. I pointed this out before also, that the first 2 weeks that you have pertussis, before you get the whoop, you have mild cold symptoms and you're contagious during that time, but you have no way you wouldn't know that you had it because you don't have that characteristic cough yet. That's why getting vaccinated is the best way to prevent other people from getting this illness. Adults who have never seen the Tdap vaccine, that's your tetanus, diphtheria, and pertussis vaccine, should get one. And no vaccine is 100% effective, but people who are vaccinated can still get it, but I point out the illness is less severe. So that's my talking points for respiratory illness prevention during the season. So I'm happy to answer any questions.
Thank you, Dr. McMillan, for that brief update. Do we have questions or comments from council?
I have a comment.
Go ahead, Councilor Marshall.
Thank you for the update and continuing to give us an update on pertussis. Those are really startling numbers, and I wonder, and I think we've talked about this before, what outreach or really what we can do to encourage people to make sure they have these vaccines.
I agree. I mean, it also school requirements for pertussis vaccine as well. So, but that's, those are older kids, but we certainly get a lot of messaging out. I believe we've done some news releases on this. We've gotten messages out to providers, and we've also have a social media presence where we mention this.
Thank you.
Other questions or comments? Karen? No? Okay. And we don't have Michelle on, is that correct? Okay, thank you. So I just want to make a couple of points. And one, I've gotten my updated COVID-19 shot, but I just learned this morning that I may need another one. So what's the time period after you get it to get the second one?
I believe you can have it. Boy, I'm checking on this. After a couple of months, you can go ahead and get the next one. I've talked to your healthcare provider about it as well.
Okay. So, and then that's a good segue to my other point was, please, everyone, talk to your health provider. I mean, the schools are a breeding ground for all these different illnesses, and that's why there are requirements. It's all about protecting your children. It's all about protecting your neighbor's children. So let's educate yourself, talk to your health provider, and make good choices about these vaccines. Additionally, just as kind of a general statement, eat healthy foods, exercise every day, at least every week. Keep your weight down. There are so many negative health consequences to being overweight. And that's a good defense against all these illnesses, is being really healthy. So let's live healthy lifestyles, all of us. I wish we could emphasize that on every opportunity from the Board of Health and your updates, that there's so many negative consequences to being overweight. So let's get on top of it. There's things you can do about it. But first and foremost, talk to your health provider. Do what's right for yourself, for your family, and for your neighbors. Any other comments? Otherwise, we'll, yeah. go ahead,
Councilor
Dr. Melnick.
Medvici, yeah, if it's been 2 months since your last dose, you can go ahead and get it, but I would still talk to your healthcare provider. Sorry about that.
No, thank you. Okay, so I think that concludes our update then from the Board of Health. Dr. Melnick, thank you.
Thank you.
Do we need a